Hello, this is Muhammad Ghaznavi, and today I'm going to discuss regarding OET writing with you people. So, most of the candidates they are asking this question most frequently, like, what is the right pattern, or can you give us some model answer or some format of writing? Why is that? Because they can see a lot of people are selling writing structure. So, what we can look for? So, as a reference record, being an OET trainer, when I have to look for some right pattern, so how can I teach my student what would be the appropriate format of writing OET letter? I was not able to find any standardized structure as per the OET official guidelines. There are two things that can be found on their OET blog. First one is the chronic format, and the second one is the thematic format. So let's have a look into these two formats. So to begin with, the chronic format means the sequence of events in any of your letter. If you are a doctor, nurse, pharmacist, dentist, or from any other profession, and you're writing a letter of referral, and there is an ongoing condition, there is a progressiveness in the condition, right? So what you have to do, you need to start from first visit and you can take toward the last visit. In the chronic format, mostly we should summarize the first few visits and we have to expand the recent history. And now coming toward the second important question, in the chronic format, where to write it down the social plus past medical history. Again, social plus past medical history is totally subjective. Subjective mean it's totally depend upon its relevance. If your socioeconomic details are relevant to the diagnosis or to the reason of writing, then we may bring it up after the introduction before writing the medical history. However, if it's not relevant, we may write it down before the conclusion. Not relevant mean it's not that much significant. It is relevant, but it is not that much significant. We can write it down somewhere down the grade. Now, in the same format of writing a chronic letter, if your socioeconomic details are significant, then we can write it down that thing after introduction. However, this is a kind of thing that you need to see the letter and understand according to your judgment, whatever you believe is the right decision on the exam day, you must go with that. Depends totally upon the recipient. And second thing is the issue. Now, heading toward the second format as per the guideline of OET, that is a thematic format. As the name indicates that as it's appropriate, the theme base. As a matter of fact, most of the candidates misinterpret this thing with the emergency referral letter. They believe that in emergency referral letter, you have to start from the recent visit after introduction. So it can be written if your letter demands you to write it down in this way as per the thematic response. But in some cases, even if the letter is emergency or urgent referral, you can write from the first visit toward the last visit. But specifically speaking, if it's an emergency situation and you're writing in a chronic format, our suggestion would be to briefly summarize the first few visits and then move on toward the today visit and expand it down. Still, we would prefer to write from today visit in emergency referral letter. Now, second format of writing the thematic letter, it would be sometime we can see that the first 2-3 visits are totally irrelevant to the presenting problem. So we can start maybe with the third visit or fourth visit and accordingly we can write it down the letter. So to summarize the information in OET writing letter, if you're a doctor or a nurse or pharmacist, you have to see that letter can be written in either chronic format or either thematic format. Socioeconomic details is totally subjective to its importance, like should it be written above, after introduction, or should it be written below, before conclusion. Totally depend upon the significance of social plus past medical history. And in thematic format, you have to prioritize the details that is more significant. Specifically speaking, as an example, we have taken an example of emergency referral letter where we prefer to write it down from the recent history. But again, it's totally dependent upon the case notes. It can be written either way around. Now, the last thing that I would like to discuss in the structuring or the organization of the writing task is the discharge letter for nursing and medicine. Mostly, it's in a conventional letter of discharge between doctors or between nurses. Like if I talk about OET medicine, specialist is writing back to a GP, right? Or if you talk about the OET nursing, let's say ward nurse is referring this case or discharging this patient, and he is requesting or she is requesting from community nurse to a district nurse. This is a conventional format of writing a discharge letter. In these two of the scenarios, like for medicine and for nursing, we normally follow the chronic format, like from the ward stay, then the rehab, then the discharge plan, or from the hospital admission details, like presenting symptom in a summarized and concise manner, then the nursing management in a summarized or concise manner, and then discharge plan should be expanded, right? Same is the case with the nurses as well. If you are a nurse and you're writing a letter of discharge, so conventionally speaking, we do start from the post-operative management, then the nursing management, then the discharge plan in the same sequence. But again, it's totally depend upon the case note. Sometimes we don't have much information given in the case note related to the ward management or the nursing management. We do have a lot of information in the discharge plan, such as the dietary management, wound care, physiotherapy, social support, psychological support, and so on. So what you can do then, according to the situation of the letter, you have to prioritize the detail. If you're writing this letter to a community nurse or district nurse, so you need to see which is the most important detail. Like first of all, it is said we can start from the, let's say, wound care. Should we start from the diet? Should we start from the physiotherapy? According to the requirement or the condition of the patient written in the case note, you can decide like how can you sequence the information inside the paragraph in this discharge letter, because this is a bit of different discharge letter as compared to a normal discharge letter, right? Anyhow, now we can also have the last category, that is mostly a request type of letter. This letter organization is a bit challenging. Why? Because in this type of letter, you would not be writing a letter to a doctor. If you are a doctor, by the way, like you're a candidate of OET medicine, you might be approaching to a social worker, to a physiotherapist, to occupational therapist, to the care manager. It is less likely that you can have this type of letter. But in the last 1.5 years, we had seen maybe 2 times that we had such letter in OET medicine. That's why we want to discuss this letter. So focus should be according to the requirement. If you're writing this letter to a social worker, now the socio-economic things will be more important. If you're writing this letter to a person who has to manage the pension care, so we will focus more on the financial dependencies of the patient rather than focusing on the post-op management care, the wound care and the diet care and so on. So, by the way, the thematic response can be tested in such letter when we are writing an unconventional letter, not between the healthcare practitioner, but like from the same profession, the doctor to doctor or nurse to nurse communication. But it can be from doctor to physiotherapist to occupational therapist, or from nurse to physiotherapist to occupational therapist and so on. So if I would close this information in one line, I would suggest you guys just to have a clear focus. Like why should be very clear in the introduction. Specifically, I'll be discussing this thing with the nurses. I have seen most of the candidates in OET nursing, they're struggling in difficult letters to clarify the purpose of writing. Just because they formulate their introduction and in their formula, that letter would not be a best fit. So what I can suggest you guys that you must have a why in the introduction. Like why are you writing this letter? It should be clear. And according to that why, you should sequence the information. So if you're a doctor or nurse, you must just work on the clarity of the information after your selection and the purpose of the writing task. It would be quite helpful for you to pass your OET writing. You would not fail this exam just because of the fact that you will be clear in your writing response. I hope that will be a helpful video for you. So we are going to discuss some more videos regarding to OET writing. So stay tuned with us and please feel free to ask me if you have any question in the comment section. We'd like to answer that. Thank you very much.